Hi, everybody. I'm just waiting for a quorum. Five, right? Five, two.
Hi, how you doing?
Great.
Hey,
thank you.
Hannah, I didn't think you were gonna make it. So you're pushing the stroller out there.
Yeah, well, the ride came just in the nick of time.
One, two, three, four, five, six. Who's, anybody, is B Buchanan? Oh, yeah, I guess I can count too. Are we ready? Are we live?
Yes.
All right. All right, let's call this meeting to order. It is, believe it or not, June 9th. I don't know how you guys are feeling, but it's moving along. So, public comment. Roll call. Go ahead, Amy.
Allen Ginsberg,
Here.
Andrew Held, Carla Pohl,
Here.
Corey Tello,
Here,
Hannah Eisner,
Here,
Judy Buchanan,
here,
Richard Janetti,
Here.
Robert Colhase,
Here.
Scott Hume,
here,
Sonia Reese, Susan Schaefer.
here.
Thank you very much. Hope everybody is doing well, staying as cool as possible. Do we have any public participation, Amy? No. All right. So we have, our next agenda item is to approve the minutes of the special session on May 4th, 2021.
I'll move it.
Second,
Second. We've had a motion and a second. Is there any discussion? All right. Amy, could you call the roll, please?
Allen Ginsberg,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Yes,
Hannah Eisner,
Yes,
Judy Buchanan,
yes,
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
yes,
Susan Schaefer.
yes, and I believe Sonia has joined us.
Sonia Reese.
Sonia, we're voting on approval of the minutes from the special meeting.
That's
Okay.
it.
I think that's yes. All right. Our next thing is to approve minutes of the regular session held on May 12th, 2021. Do I hear a motion? Susan, second. Corey, any discussion? Amy, please.
Allen Ginsberg,
Yes.
Carla Pohl,
Yes.
Corey Tello,
Yes,
Hannah Eisner,
yes,
Judy Buchanan,
yes,
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
yes,
Sonia Reese,
yes,
Susan Schaefer.
yes,
Thank you, Amy. Our next agenda item is a consent agenda that is in your packet. Do I hear a motion? Bills to be paid, do I hear a motion?
second,
I can't see who that is. Oh, is that Mr. Coley? Oh, okay, sorry. And Judy's the second. Sorry about that. It's like, is there any discussion? Amy, please.
Allen Ginsberg,
Yes.
Carla Pohl,
Yes.
Corey Tello,
yes,
Hannah Eisner,
yes,
Judy Buchanan,
yes,
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
yes,
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
All right, our, excuse me, our first informational item is the dental clinic update. It was in your packet on pages 3. And I believe Tammy is with us if you have any questions. Yes, Hannah? Maybe it's easier to look.
My only question really, we have talked over a number of years of, not wanting to compete with the programs that are coming on with it. So I can understand the adult was a good move to just let that fall to the other providers. Are we looking at something similar with the children's clinic as well? I mean, I know that that's in a little better shape, but you said we're down a hygienist. Is there a reason to look at maybe moving out of that?
A hard time answering that question right now. I'm very interested in learning more about what Chestnut will offer when they come on board. I don't know. I prepared the memo just in response to someone's request a few months ago to have a dental clinic update. So I thought we would just, for right now, keep it just short and sweet. And I just gave you some bullet points of things that I thought you might like to know. But I don't have an answer as far as children's if we're considering doing something different.
Mr. Colhase, Bob?
At some point, I don't know if Dr. Hume can give a perspective on this. Obviously, we defer to him on some of the specialty here. If not tonight, in July, to give comment on the overall state of the state of services in our community and how this all fits together, because I'll rely heavily on Dr. Hume's opinion.
Go ahead, Scott.
I think in the last couple of years, kind of what's happened in the local dental environment is a number of corporate offices have opened. Some dental, nationwide corporate offices, or at least regional corporate offices, and they've opened their practices up to anybody that can be seen. Whereas a lot of local dentists restricted access to patients on public aid and other, Scott Resource Center patients, things like that. Now that these patients have a pretty easy access to go to these corporate offices, and they kind of have preferred those because they're well-known names and they think that's a better deal. And it's so I think there's less problem with access to care than there were 5 or 10 years ago. And I don't see that probably changing real quick. I think that they're going to continue to see patients, whoever comes in the door. And so I think that's kind of maybe downplayed the need for the health department to be involved in dental care because they have this access through these other offices these days. I'm not even sure what the Chestnut Health Services program, what's that is going to involve, and if that'll just be adults or be children and adults. I think if we ever decided that the health department dental clinic was more in the red than in the black, then I think there'd be access to care for those patients. But I think a lot of patients that I've talked to that have kids that have gone to the health department dental practices are really happy with it, and I think they want to continue to do that. The adults were more just on an immediate, emergency kind of basis, whereas the kids, parents were taking them for regular checkups and regular cleanings and instructions on dental care and that kind of thing. So I think it's more important to keep the children's dental clinic than the adult dental clinic at this time.
Thank you for saying that, Dr. Hume. I appreciate that. I was going to make sure to mention we have had families who have gone out to other corporate practices, as you said, and have come back to us. And they really like the care their kids receive here. Our staff is really good with the kids. Our dentist isn't a pediatric dentist, so to speak, but she works really well with kids and also with special needs populations.
Mhm. I think one other thing was that when talking to Camille a couple years ago about the feasibility of continuing with the dental clinic, she said it was important to her because it felt like the staff was really proud of having the dental clinic at that location, and kind of not so much of a perk, but just something to be proud of. So I don't know if cutting it would affect how they view the health department.
Sonia, go ahead.
Okay. My question has to do with the community healthcare clinic. Their goal is to take care of patients that have no insurance and no Medicaid or Medicare. And they have this nice clinic, but they were still looking for staff when I talked to them last time. Are they staffed now, as far as you know?
In their dental program?
Yeah.
Yes, in fact,
A dentist or dental hygienist?
the last I heard, actually, Judy, did you send me the email? Someone sent me something about the healthcare clinic had started a collaboration with one of the hygiene schools. And so they were seeing a rotation of hygienists come through that clinic. I haven't spoken with them personally though.
Okay. Thank you.
Corey?
Do we do, kind of a continuity of care deal with like our WIC families? Do we often encourage them to have the children use the children's dental clinic? Is that a, kind of a natural transition piece? And any other programs that we have in the, in the health department that we help link them because it's right there and we can do the warm handoff kind of thing? Is that a positive?
Absolutely. We have families in all of our clinic areas, WIC, family case management, immunizations, that we all share our families. I mean, we serve the same families. So it really is a convenience for them to try to squeeze in all their appointments, kind of a one-stop shop. So.
Thank you, Tammy. Any other questions? Okay, we'll move on to our next item. In the past, we've done small group budget workshops or work groups to go over with no more than 3 of us at a time to go over the budget with Jackie and with Jessica. And we're coming up on budget time again, believe it or not, this year. Is there anyone who's interested in being a part of a small budget work group? Hannah, Susan, Judy, and Corey.
There you go.
So they'll probably take place in July, and so Jessica and Jackie will get together and give us, and myself.
Madam President, that would be 4 or 5, and that would be then an open meeting.
Well, no, we're going to have 2. In the past, we've done 2 groups.
Right.
That's why I was just trying to see if we needed 2 or 3 groups so that we're not going to we won't have more than 3 people together.
Right.
Okay. Oh, Judy, that's all right.
I would suggest that we double check that the people who are on this groups aren't on the same committees, because that could trigger an open meeting since they're on a public body, even if it's not the Board of Health, but if it's a smaller committee. So we'd have to be careful about who's with whom.
I'm not following
Good.
that.
Yep,
So-
thank you.
Glad everybody else knows.
So,
Yeah.
right. I don't know who's speaking. So we have a number of smaller committees that meet regularly, made up of our board members here.
Oh, okay.
So we want to make sure that we don't trigger a majority of a quorum on one of those smaller committees with the same people. We just have to figure out who those people are when they're put together.
Okay. When you say smaller committees, you're talking about smaller committees in the Board of Health or smaller committees throughout the county?
Anything really, but particularly the Board of Health, because that's where they would show up.
Okay.
So we probably are gonna have to have, in some cases, based on the people that raised their hand, we're probably gonna have to have meetings of 2 to avoid that.
And the 4 of us who raised our hands are all on the same committee of the board.
Right.
Yeah, we're the usual suspects.
So anyway, it'll be worked out.
Yeah, we can do that. I think we can figure out how to do this.
Yep.
All right. Any other concerns? If anyone else decides that they want to join one of these are just small, they're usually for about an hour. We try to keep it under about an hour. We go through the budget. If you haven't done a budget session, you want to be on several of the members that have said that they want to do this are excellent tutors in the budgeting process. So if you just want to listen to kind of get a feel for the budget, I mean, for me, it's very, very helpful the first couple of years. So just let me know if you want to be on one of the work groups. And then Jackie and Jessica and I will get together and see if we can't and then we'll get some dates together and you can attend. Yes, ma'am. Corey.
Well, I was just gonna say, if anybody, I know we're coming out of Zoom because we can, but I'm wondering if we would have greater participation because some people might be able to make it if they only had to Zoom in for an hour. I mean, is that still a possibility that's maybe at least one of them could be a Zoom call?
Should be.
If that would help anybody else on the board, be able to attend if they so desire.
Good point. It should be.
Okay. We'll look at that. Yes, Hannah.
Yeah, just following up, and I heard Samantha in the background somewhere, but I didn't know the changes that allowed the remote attendance during the COVID, whether once we go to in person, were those sunsetted or so? I mean, if we go back to in-person meetings and the only remote attendance would be as per the old statute? Or is that an unknown?
She's thinking.
Why don't we have county legal work with our staff?
County board rules were sunset in May for the remote meetings, so that it went back to the old way of how you could come in remotely. So yeah.
Okay.
Yes, that's exactly right. And then as far as OMA, there was an amendment with OMA last summer, and that amendment has not yet been changed. That amendment allowed for the remote hearings. So as the Board of Health, the county board rules don't necessarily apply to you because you have your own rules. But the county board has been meeting ever since the beginning of June in person.
Thank you, Samantha. Any other questions or discussion? All right, let's move on to Behavioral Health Coordinating Council.
Sure.
Go ahead.
Well, we're going to be meeting on Friday morning, and we're going to meet in person because the notice was, yeah, we're back in person. So the agenda includes a presentation by the executive director of the Central Illinois Neuro-Restorative Program, Pat Durrell, and I don't know any more about it than that. And there's nothing in our packet, so we don't know where it's going. We're going to get an update on the Regional Office of Education and what's happening with them with behavioral health these days. We're going to be talking about the Mental Health Action Plan and an update on that. And then another topic is Heartland Community College's Recovery Support Specialist Program. So Heartland is they're really moving. I'm so proud of them. They're doing a lot of things in healthcare and a lot of things in other areas as well. And this is another one that we'll want to hear about. And then an annual report on what's going on with the Coordinating Council program. So that's what's coming up. Stay tuned. I'll let you know more next meeting and what I learned.
That's great. That sounds like it's going to be a very interesting meeting.
Yeah.
Thank you, Sonia. Mental
Well-
Health Advisory Board? Corey?
We met on May 20th, and the primary purpose for that meeting was for us to go through the Mental Health Advisory Board bylaws and update them. We had been kind of going in and out of that for a while, and so it was time to get serious and really get into them and go through them pretty much line by line and edit. So that's where we are, and we actually were not able to finish that work during that meeting. So we had set a special meeting just for the purpose of completing them. And that will be on the 17th of June. And then the edited bylaws will come back to this body for your approval. So that was kind of the major purpose of the last meeting. But obviously we continue to just try to function as the group that helps identify, existing and emerging needs and bring that to your attention.
Thank you, Corey. Anybody have questions for Corey? All right, our next item is County Board. Susan?
The Health Committee did not meet this month because we had no items for action, so I don't really have anything.
Okay, that brings us to the Behavioral Health Policy and Funding Committee. Hannah?
Yeah, thank you. We did meet. We had basically 3 items on our agenda. One was to talk about the budget, mental health budget. The second was reviewing the first set of quarterly reports for our funded agencies for 2021. And the third item was mental health first aid. On the budget area, we just wanted to really start to talk about money. Last year, we had to not fund some programs and ask others to submit revised budgets to make it work within the dollars we had available. And that included last year, 2021, that included some money from the fund balance. So we've, over the last couple of years, supplemented the property tax money with some fund balance money. But we still, based on the asks, we were not able to fully fund any of the programs. So we just wanted to talk about that as we're approaching budget time. And I think you can see all of us on the committee are interested in the budget is to look at, what the levy can produce, whether we should be looking at using more fund balance money. We also talked about the possibility of, maybe partnering more with some community organizations to leverage these dollars for bigger, better programs. So we talked about that. And we also, the other topic that came out and when I was going to ask about this meeting is, the money that the county is getting under that Federal Rescue Act. The town and the city are receiving monies also. And I know that there's talk of, planning for the use of it for the county. And so we talked about whether it'd be appropriate to have some requests come out of the health department related to mental health. So it was a pretty active discussion. The second was the quarterly reports. You have those in your packet tonight. We wanted to take a peek at them before they got to the full board. And, we were pleased to see that the agencies were really keeping up with providing service through the pandemic for the most part. I think you can see the numbers. The report was tweaked a bit to provide some year-to-year comparisons, which we thought was useful to kind of get a better picture, particularly as our dollars fluctuate somewhat in what we can support. The biggest news that came out of that report was the report that the psychiatrist at the Center for Human Services, Dr. Abuelita, is retiring effective the end of August, I believe. So we felt we needed to go back to the Center for Human Services and ask them to provide us with some updates or revisions to the budget that they had provided us with the assumption he would be on staff. So they've described taking care of that by adding an APN, and there'll be some need to contract for supervision for that person. So we wanted to just see an updated budget to reflect the changes and also any kind of staffing changes. So we'll be looking forward to getting that in the next month. And then the third thing was the mental health first aid. And I know there was some confusion about the item on the agenda this evening. We had approved right at the end of, I think, last year, money to provide money to assist in training, particular people to learn to do virtual training for mental health first aid, and that was for adult trainers. The item tonight is for youth trainers. So we wanted to get a report on what's happened with the program. It doesn't fall under the behavioral health division, I guess, of the health department so much. It's operated by Maureen Sellers, who does a wonderful job, and she's got training experience. So we just wanted to get a report on that and make sure that, there was some good marketing taking place to make sure that we feel that that program offers, the program itself is wonderful. It also is a great marketing tool for what the health department has to offer for behavioral health. And so we wanted to make sure that they were doing targeted marketing to groups that could really use the program. So I'm happy to take anybody's questions if there are any, or any members of the committee who want to pipe in, and if I left anything out.
Corey, go ahead.
Yeah, I just want to, I think Hannah already said it, but I just want to reiterate that it is to train trainers. So the beauty of this is that a larger organization can send someone to be trained, and then they can on an ongoing basis train their own staff at times that are convenient, in places that are convenient for the members of that particular organization or entity. So it makes the training, much more likely to get driven deeply into some of the bigger organizations if they have their own in-house trainer. So, and unfortunately, the training is expensive. And we do partner with AHEC, which is out of ISU, in providing the funding, because the total funding is $24,000. So we would be paying, as we did with the adult trainers, we're paying for half of it.
And one last item I did forget to mention is, I think last month we reported to the board that the committee was recommending, if with some help and assistance from Samantha and how we do this, just trying to fund the existing agencies, because we know we have limited funds and that they provide some core services. So we are continuing to figure out the best method to put out a request for proposals that would accomplish that, and of course follow any guidelines we need to. So that's all I have.
Thank you, Hannah. Any questions? Okay, we'll move on to the Health Department Administrator's Report that is found on pages 4 through 31 in your packet. Were there any questions? Go ahead, Hannah.
And I want to say kudos, congratulations to Jessica for being recognized for your work in the COVID response and vaccination. And I'm glad to see that we're up with, kind of state averages on vaccinations. And not this month, but we are really not at the point where we've reached that herd immunity. And it seems to be a struggle. So I don't know if there's any information you could share tonight as to how we keep. I know we've got the clinics and, just what more kinds of advertising. I mean, I know we're going to cut back to once a week on the reports. which kind of keeps it in people's minds. But, any thoughts, what other places are doing to really push getting closer to that 70%?
Sure.
And I don't ask this to minimize or not acknowledge the hard work that's been done thus far. So please understand, I really appreciate that.
Yeah, so we are, cutting back on the number of clinics, but still seeing people be vaccinated. So, over 1,000 doses given last week, even as, again, demand starts to decrease, we're reaching that, 50 to 60% of people, of the adult population in McLean County have received at least a dose. So that's great. Working with Ms. Mango to prepare a communication plan to have for you guys next month, just to see, what we have been doing in terms of public information, and then what we still have yet planned to do, just to continue to promote the vaccine. But, we're going to continue doing clinics. We're assessing even, knowing that the COVID-19 vaccine, when we stop doing, mass vaccination clinics, it's still going to be here. And so how do we offer that in our normal health department clinics? So we're assessing that right now too.
Susan?
Thank you. I have a couple of questions. Number one, can you explain the recognition that you got from IDPH in a little bit more detail? And also, do you know if IDPH is going to update their website, because now they still have the percentage of 16 to 64, 16 to 64 percentage, and then the 65 and up percentage, if they're going to start including the 12 to 15 group also?
I'll start with that one. I am not sure if they will. They have for the statewide, so they haven't broken it down by county yet. I'm not sure if they're going to do that or when, but they have started breaking it down to younger age ranges for state totals and percentages. The recognition from IDPH really was just them reaching out to some of those counties that are at the top. We're in the top 10 for percentage of the county population vaccinated. So just reaching out to those counties and what are best practices? What are some things that we have done that have worked well? Some challenges though that we still are seeing, and just kind of recognizing that the hard work that our staff have done and that we've done to get to that point of being in the top 10 right now.
Sonia?
Carla? No, go ahead, Sonia.
I was just going to ask, do you have any trepidation about what might happen as school starts and college kids come back when everybody's back in person? Any thoughts about whether we're going to have to crank it up again or we're going to be okay?
Yeah, I wish I had a crystal ball that told me exactly, but we're planning for what will we do? Are we prepared for if we do see another uptick in cases? So being prepared for that possibility in the fall. But we've got some time now that we can get more people vaccinated. So the more people that we get vaccinated, the more protection there is for when school does start back up. So, we're again going to reassess contact tracers in July to see what we think we might need going into fall. Continuing to work with our schools, having regular calls with administrators and nurses, working with the universities, just really, again, preparing now that we know more definitely going into this fall than we did last fall, but there's still that bit of unknown because we are learning every day a little bit about COVID, about, how long does the immunity last? Will there be a booster? We don't, there's so much we still don't know.
Yep. And it's not just us, just nobody knows. We're all learning.
That is correct. Bob?
Yes, thank you. I'd like to just recognize that first bullet point on that we're in the top 7 counties, because it seems like forever ago, but things were changing so rapidly, week to week, day to day. And one of the comments that I heard early on was McLean County was behind the other counties, but people not recognizing that we weren't in the top 50 worst counties. So we started behind others as far as access. So I think it's just a testament to the effort that our staff put in to reach out and make it accessible for everyone. So just another recognition there. Also want to recognize, I think the way the report was put together was excellent, and the pages that give the summary in the boxes, which I just had it here, but it gave the summary on pages 10 and 11. That's really helpful for a quick snapshot to really understand where things are at so we can be current and be able to recognize things going on. And Tom, final thing, Tom, are you, Mr. Anderson, are you on tonight? I just thought if he is.
Yes, he's coming.
All right. Not to try to put people on the spot, but obviously your activity is ramped quite up quite a bit, and appreciate that. And so I just want to give you the opportunity because you're going to be the front and center because of the opening up. I think that your department will be front and center of interacting with things going on. And I don't know if we wanted the opportunity to say anything about that.
Thank you for the recognition. We are prepared once the state gets closer to a full opening. It's basically going to be a tsunami of requests to our department. We are preparing ourselves for that with the incremental opening. We're also seeing a reduction in complaints. So that's what's really taken up a lot of our time over the last year and a half are the COVID-19 related complaints. We dedicated over 2,000 hours last year just in COVID-19 responses of various sorts. It just wasn't complaints, it was meetings, testing sites. This year it's meetings, it's vaccination clinics, it's complaints, it's all. So as we get closer to a full opening, we're going to see a lot of that time consuming efforts decrease, and complaints just this month, COVID-19 complaints are down to 9. So there's like one a day. Haven't seen any in the this week. I don't think we have one COVID-19 complaint.
Thank you.
Yeah, thank you so much, Tom, and your staff. When I was reading the packet, I thought, well, COVID is slowed down just in time for West Nile virus. So we appreciate the work that you're doing.
Thank you.
Does anyone else have any questions or concerns for Tom or Jessica? All right, then we'll move on to our action items. The first action item is approval of funding of $12,000 for funds for the Youth Mental Health First Aid Trainers Instruction Course, and Hannah provides you some clarification on that. I don't need a second. Judy?
You're muted.
I know I'm muted.
Yeah, I said I made the motion, but you just
I
didn't hear
seconded
me.
it.
Never mind. I do need a move in a second.
And
Judy,
you got a
moving?
second.
Okay, Sonia's second. Any questions or discussion? All right, Amy.
Allen Ginsberg,
Yes.
Carla Pohl,
Yes.
Corey Tello,
I was actually going to add a little caveat onto that, but I think it's too late. So yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Thank you, Amy. Motion carries. Our next next action item is approval of amendment to the fiscal year 2021 full-time equivalent position resolution, position reclassification request and appropriation. And that is found on pages 32 to 41 in your packet.
Move
Sign-
approval.
Thank you. Second. Scott, any questions or discussion? Susan, go ahead.
My question is this going to finance next month then?
Yes.
Anyone else? All right, Amy, roll call, please.
Allen Ginsberg,
Yes.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carries. Our next action item is approval of contract for the guest block of rooms for alternate housing from June 11th to August 27th through COVID-19 contact tracing grant. That is also found on pages 42 to 47 in your packet.
I'll move
Sonia,
approval.
approve. Judy, second. Any questions?
What, up until now, what have we been doing?
Same thing.
Yeah, same thing.
Same thing.
And we, as more things were shut down earlier in the year, it was much easier to, there were rooms available, people weren't traveling. So as we were calling around to facilities, really finding that and finding that they're booking up fast. So if we want to ensure that we've got some place to house someone if needed, having something in place for extended period of time and set aside.
Remind us of what was our experience in this more intense season of people needing rooms. Did we always have 2 families or 4 families or 8, or what was the situation that we've been in intense times?
It could be a mix of all of those things. So I think we've had times where we have had families and individuals, and so it's been kind of a mix, but sometimes it has just been 1 or 2 individuals at a time, and then again other times it has been multiple if we're dealing with more than one person that needs to quarantine separately.
Well, it sounds like the quarantine is really a quarantine. You don't get out of your room and you don't go downstairs and food's left at your door and all of that. Does somebody call on them from the health department to see how they're doing?
Yeah, so those individuals are, isolation or quarantine, so they're followed just like all the other individuals who are isolated or quarantined. But yes,
But a phone call.
Yep, they've got a point of contact also at the health department for if they need anything.
Mhm. Okay.
Any
Thank you.
other questions or comments? Bob, did you? No, okay, sorry.
No, I'm just reading, sorry.
Okay, Amy, if you call the roll.
Allen Ginsberg,
Yes.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Thank you, Amy. Motion carries. And this also kind of reminds us that we're not completely out of the woods. So when you're interacting with the community, be sure you're encouraging vaccinations. And if you're not vaccinated, wear a mask. Our last action item is the authorization of the board president to approve the fiscal year 22 State of Illinois renewals and contracts. And those are found on page 48 of your packet.
So move.
Okay.
Okay.
And second, Bob, any questions or discussion? And these are routine contracts that we renew every year.
Uh-huh.
Okay, Amy?
Allen Ginsberg,
Yes.
Carla Pohl,
Yes?
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Thank you, Amy. Motion carries. Is there any other concerns for the good of the order? Judy?
Yeah, just to mention, and thank you for your support of the mental health first aid funding. I think one of the things that we discussed with our funding and policy committee was the fact that mental health needs are really high on everyone's list now as we emerge from the pandemic. And a very, very exemplary example of prevention and help is mental health first aid. And so we are hoping, we've asked the people on our staff, starting with Maureen, to really work with our public affairs coordinator, because what we know is that we have a resource that can be very helpful for those of you who may have taken the course. It can be a very useful resource, and we're hoping that they can work with Mary Ann to find out some more ways to make sure the community knows it's available, as well as how to take advantage of it, either as an instructor or as a participant, because it does offer our community something right now that we have the sense and we're reading everybody is longing for, and that's some kind of behavioral health support. So I think we can take some pride in moving that forward, and there's a coalition that Maureen works with, and it's a very useful, productive program.
Thank you, Judy. Hannah?
Thank you, Carla. I just wanted, it's probably a request for the next meeting, but there's all the talk swirling, and of course about the money that's going to be, maybe it's already part of it is here from the federal government. And I know that there's been mention of some process by which departments should be submitting requests for that money. I don't know what we've been doing within the health department, and I guess what I would think is that as a board, we might want to chime in on that. I mean, we may have some thoughts of that we could suggest, or at least have a discussion about it. And I would assume we'd need to do that as we begin to enter the budget cycle. I don't know whether this money will be just incorporated in out year's budgets to be spent. I mean, I don't know that much about how it will be done, but I do think that a large portion of it was focused on mental health, the public health needs, and we should be first in line. So I have, a few ideas, but.
I'm wondering if Jessica maybe has, I know they've begun budget discussions. Are we anywhere into the process where departments are being asked or suggested that they take a look at what piece of that might be helpful as they, try to accomplish their mission? Are we there yet, Jessica, or is that in the future?
I think those discussions will be in the future, but we've started talking with county admin, making a kind of a list of possibilities, because I think they're still finding out also what this is going to look like. I think that's, the counties are still learning how this will roll out, when it'll roll out, and what it'll look like. But, we've already started talking about that, but yeah, having discussion in July on some other
Good.
ideas.
Good. Well, I think this has already been identified. Our department, and we're being recognized by the state for the work that you, Jessica, and others have done. We ought to keep that in mind, because as you look at the whole spectrum of what needs to be accomplished, a lot of it is in the area of public health.
Yeah, so I would hope that at our July meeting, we could at least have some idea of what ideas have come out of discussions with staff, and I would assume maybe some board members might have some suggestions to add to the list, and kind of figure out, we just don't want to lose our chance here. It's a nice piece of, obviously it's money that you can't build programs that you don't think or know that you'd have money for future operations with it. So it's sort of a tricky business of figuring out how best to use it.
Sonia, go ahead.
I was going to add to that and say, we have seen the health department come into a whole new realm of recognition in the past year. So many people wouldn't have known very much about what we do, and it's just come to the surface. So we should not let this opportunity of our presence in the community be lost. Work on it, drive it, keep it going. Let us help. Let us know what we can do.
Thank you, Sonia. Anyone else? Any other items for the good of the order? All right, then. Everybody have a great month. Be safe. Stay safe. And stay cool and have a good summer. We'll see you in July face-to-face at the health department.
Good.
Yay.
Okay. Thank you.
I mean, I have to wear a whole outfit.
Yeah, Hannah, bottoms too. Never mind.
No, your pajama bottoms are fine. Just keep wearing it. We're okay with that.
I like sitting outside here,
No kidding.
It would be fun if we all came dressed as we have been on these meetings.
Yeah.
Surprising.
Now, are we doing masks or not masks in July?
I would send out an email to clarify that at that
We
time.
will.
Yeah, that would be good.
We just have to look at whatever the guidance is
Right,
from
okay.
IDPH.
Okay.
Well, I guess anybody who's not vaccinated would be definitely wearing a mask.
That is correct. If you're not vaccinated, you must wear, well, you don't must, it's a little strong. You are encouraged to wear a mask.
Mhm.
There's that picnic table out back that we could all sit at. It won't seat us all, but lounge chairs. Anyway, all right.
Tiered seating.
All right, you guys have a great month.
Bye-bye.
Thanks,
Bye.
Al.
Thank you.